Welcome once again to Wellness Wednesday. I'm Dr. Vyas with New Wave Wellness Center. And in this episode, I am going to be discussing a vitamin that is not very well known, but is really required by the body. And what I'm talking about is something called vitamin K. Recently, vitamin K has been getting a little bit of popularity because there's a lot of benefits that have been discovered. So let's start with what exactly vitamin K is and why do you need it. All right, so vitamin K is a part of what's called the fat-soluble vitamins. Vitamin K, most of you may know, is found in dark green leafy vegetables, right? Your kale, your collard greens, your shards, those kind of things. And those will provide you with enough vitamin K if you're eating those on a regular basis for your body to, function the right way, so you don't need to supplement. But the biggest one that the research has shown recently now is something called vitamin K2. You may be familiar if you've bought a vitamin D supplement recently that it contains something called vitamin K2 with it. So recent studies have shown that vitamin K2 not only helps with the absorption of calcium, but the biggest thing is it shows the calcium where exactly to go. So your D vitamins is essential for absorption of calcium from the body or from your gut, but for it to go to the right place, they've discovered that vitamin K2 helps with that. So what your vitamin K or your vitamin K1, just one of the other components of the vitamin K, does is it helps with what's called your blood clotting. So it helps with, there's something called the blood clotting factors. So it helps clot your blood. And that's why some people that are on, blood thinners or anticoagulation medications are advised not to be taking too much of, green leafy veggies and all, because you end up getting too much of that vitamin K, which disrupts what the mechanism of the vitamin or your medication is. But when you have enough vitamin K1 in the body, it does get converted into K2. To help with that, because as I said, it's a fat-soluble vitamin, what you need some good fats in the body. So again, it goes against a lot of people are thinking about. If you have any heart disease and all that, you'll be like, why do I want to eat fatty vegetables or fatty foods like your grass-fed meats or butter, cheese, that kind of deal? Is because that helps in converting that. It also contains a lot of vitamin K2. So why? Okay, let's say, so one of the things I mentioned is K2 is required to help you transport or take the calcium into the right place. What do I mean by that? If you're taking just a lot of calcium, what happens is they've discovered recently, again, broader research and studies have shown that people that are, say, osteoporotic or osteopenia, and if they're taking a lot of calcium, if the calcium is not being absorbed the right way, and it is being absorbed, it ends up getting into the arteries. It goes into the wrong places. Your arteries, your joints, so people end up getting more stiffer. So instead of going directly into your bones, it's ending up in the wrong places. Soft tissue, arteries and all, so you get calcification of your arteries. Now, what K2 does is it actually helps reverse some of that calcification. There's been a lot of studies with cardiologists recently who are showing, or they're suggesting that their patients that are on heart medications take some K2 because it is helping decalcify. So it takes away the calcium that's built up in your arteries right there. It also shows that it helps with the elasticity of your arteries. Again, so we want that. So somebody would say hypertension or heart disease or any of those kind of problems, it helps take or makes your arteries more elastic, which means they can rebound better and helps with any of your blood pressure issues. So those are a few things of K2, and that's why it's gaining more popularity recently. And again, the way I said, you may have noticed if you're buying a D supplement, your D3 supplement, it contains a little bit of K2 in it. So you do want to take that. It is amazing. You can actually take K2 on its own. Or for some of you that are doing your green smoothies in the morning like I do, you're getting enough of that from that. So they say that about half a cup of kale contains 531 micrograms of vitamin K in it, which is more than 400% of your daily recommended requirement by the body. So your kale, your collard greens, deep dark green leafy vegetables. Now certain meats, your grass-fed beefs, eggs, the cholesterol from the yolk is not exactly a bad thing. It's actually very good for you because it contains some K2. So you want to do that. Certain cheeses, your soft cheese, your hard cheese. Again, cheeses that are organic or grass-fed are more better, or not more better, they're better than any of the regular ones. So those are a few things. Now, if you want to supplement on your own, they suggest about 100 micrograms of vitamin K2 on its own on a regular basis. So if you're somebody that suffers from osteoarthritis, blood pressure issues, even like calcification of your heart, right, or calcification of your arteries, you will definitely benefit from this. So start taking some K2 and reap the benefits, because K2 is definitely very important and it's here to stay. All right, I hope that information helps you, and I'll see you in the next episode.